Hello, my name is Dr. T. George Koshi. I work as consultant physician and endocrinologist at the MOSC Medical College, Colongeri. I belong to an organization called PACES, Professional Association of Clinical Endocrinologists. It's an association of endocrinologists based in Kerala, and we are doing small educational videos for the general public to make them more aware of diseases and conditions in endocrinology and diabetes. Today my responsibility is to talk to you about the symptoms of diabetes mellitus. Diabetes mellitus, if you look at the meaning, is taken from two words, diabetes and mellitus. Diabetes actually means siphon and mellitus means honey or sweetened urine. So in diabetes mellitus, the person passes a lot of sweet urine or urine with sugar in it. So what are the main symptoms of diabetes, or what does the patient usually, what does the person come to the doctor with? They will have increased thirst, they will have increased frequency of urination, they will have increased hunger, and because of that they may have increased weight loss. On the other hand, sometimes diabetes mellitus may be totally asymptomatic and just detected during routine checkup when going to see the doctor. Diabetes mellitus is a disease and a condition that can affect all the systems. It can affect the nerves, how the nerves supplying the hands and the legs. You can get numbness or lack of sensation. You may get burning, you may get tingling. These are symptoms that these are the problems that some patients come to us with, and very severe affecting, if the nerves are affected very severely, they may have difficulty in gripping objects, they may have difficulty in walking, they may complain of unsteadiness in walking, especially when they are walking in unfamiliar places. If they are walking in the dark or if they are walking over an unfamiliar ground, they may have a tendency to fall. Diabetes mellitus can also affect the nerves affecting different organs. For instance, it can affect the movement of food and water in the gut, in the bowel. Patients may complain of early satiety, meaning they have a bloating sensation or a fullness soon after eating. They may complain of constipation. They may complain of increased frequency of motion or diarrhea, especially at night. They may even, at very severe situations, they may even have vomiting. Diabetes can affect the genitourinary system, meaning the urinary tract. It affects the urinary tract. Patient may have increased tendency for getting urinary tract infection. They may have increased tendency for having fungal infections, especially of the genitalia. It can present as candida or thrush or in women, and it can present as candidal infection of the penis and the glans in men. Other way that can affect the genitourinary system is it can cause vaginal dryness or soreness in women, which can make intercourse and sexual contact difficult. In men, at very extreme situations, it can even cause erectile dysfunction or impotence. Diabetes mellitus can affect other important systems. It can affect the eyes and cause retinopathy. Retinopathy may not have any symptoms in the beginning, but as there is progression of retinopathy, person can become totally blind. It can also affect the eyes by causing cataracts in the lenses, which again can make vision difficult. Patient can have blurring of vision when they walk. They may have difficulty in vision when they drive in the car. They may have difficulty in vision when they are reading a newspaper. Then diabetes mellitus can also cause wounds that do not heal. Now, how does that happen? It can cause problems with blood supply to the lower limbs. It can cause decreased blood supply. So, if there is a wound, it will not heal. And another reason people with diabetes get wounds in the lower limbs is because they have lack of sensation. So, when they step on something sharp or when they step on a sharp stone, they may get wounds which then take their own time healing. And in very extreme situations, if you have poor blood supply, poor blood flow to the lower limb, you can even get gangrene, where a portion of the limb or the toe actually dies because there is lack of blood flow, and that may result in amputation. Diabetes mellitus can also affect the kidney. It causes increased protein loss in the urine, When that is very severe, you can get edema or swelling of the hands and feet and face. You can get fluid accumulation in the lung, and very slowly diabetes can affect the kidney to cause chronic renal failure or chronic kidney disease. At end stage chronic kidney disease, the person may need dialysis to continue a normal life. Then what are the major complications of diabetes? So what are the problems of diabetes that can affect you and actually cause problems with survival and problems with life? Diabetes can affect the heart, can affect the blood supply to the heart, and the person may have a sudden heart attack. He may have a condition called heart failure, where because his heart is not pumping normally, he will have fluid accumulation in the heart and the lungs, and when he will need to get admitted to get rid of the fluid in the lungs. Diabetes mellitus can result in conditions like stroke, where you have decreased blood supply to certain parts of the brain and the person will end up getting paralyzed, or he may have problem with certain functions like speaking, or he may have weakness in just one limb. Diabetes mellitus can also cause a loss of the limb because of gangrene. So why are we telling you all these things? We are telling you all these things to know what diabetes mellitus presents like. The small take home message I have for you is, diabetes mellitus, like I said in the beginning, may not have any symptoms. It can come and sit with you like an innocent bystander, but then it will finally end up being a silent killer. So you need to be aware of diabetes, and if you are more than 35 or 40, please do check your blood sugars fasting and after meals once every 6 months. And if you do have diabetes, please take it seriously and liaise regularly with your medical practitioner or doctor. Follow the advice he or she gives in terms of diet, lifestyle modification and medicines. Yeah. Thank you so much for your time. I hope you benefited from my talk.